Americans, do you want universal health care? Why not? Most cancer treatments will be over $100,000 for mild ones that are internal. On the high end, I've seen 2.5-3 M in bills from cancer, and that's with insurance. Edit, this gained a shit ton of traction. I should specify, many insurances are very different and have different clauses in them. Some modify maximum out of pocket, some have limits to how much they cover, others are barely any type of insurance and are just there to appease the powers that be in order to hire full-time. These things are subjective. If you're reading this, check your own insurance. Some will cover everything, some have a minimum copay, others will have a maximum allowed coverage, and anything after that falls on the shoulders of the patient. They are all different, from each state, each job, and every person. Policies vary, it's important to know yours. I had a pretty well-paid job making sure the health system I worked for got reimbursed by health plans. 100,000% support universal health care. I have an arsenal of stories on how truly fucked up the healthcare system here is, but here's one that has stuck with me. Reviewing a high-dollar chemotherapy claim that was unpaid with my team. Ask them to pull the EOB, explanation of benefits, that essentially outlines how the health plan paid what they did or why they didn't pay. The health plan had marked the entire amount, over $200,000, as patient responsibility, meaning they were telling us to bill the patient for it. I personally called my counterpart at the health plan because it seemed like a mistake. Nope, turned out the patient exhausted their benefits, meaning they essentially ran out of coverage per the terms of their health insurance policy. This was a PPO plan the patient had through work. In other words, this patient, who is now fighting for their life and still in the middle of a cancer battle, is going to get saddled with a six-figure medical bill despite doing everything right by getting good coverage through a good job. Quite frankly, if the cancer didn't kill them, the stress of figuring out how to pay that would have. This same health plan had an insanely ritzy office and so many perks for their executives it was beyond belief, yet held non-profit status. Made me sick to my stomach. I left healthcare. When my mother was dying, she was receiving treatment at the hospital she worked at. She was previously a nurse for 25 years, but had moved to billing 5 years earlier. The insurance company tried to tell the hospital what they would or wouldn't cover for my mother, a decades-long hospital employee receiving treatment in their own hospital. Her colleagues told us not to worry about it, and the talks about what was and wasn't covered never happened around us again. I often think how it would have gone if she hadn't been their employee and hadn't worked in the department she worked at and hadn't been getting treatment in their hospital. It's so fucked. At the end, after she died, we got a bill for $1.98 million, but our portion was supposed to be $900. We just threw it away. Hey assholes, she's dead. Go shake the change out of her corpse if you want it that badly. The whole system is a mess. Oh my gosh. I've been on the same ADHD meds for years and I cannot tell you how many times I have had to go without it because the insurance company would bitch about how I didn't try certain other medications first, despite my doctors sending proof that I did. This has happened countless times. Shouldn't one time be enough? And sure, we can pay out of pocket, but insurance saves us at least $100. And not to mention all of the other medications I'm on for various health issues. People cry that universal health care equals communism. 1. But I'd rather people not have to struggle through unbelievable stress because they can't afford something that will save their life. Call me crazy. And that may sound dramatic, but there are plenty of stories here from people who have literally been through this exact situation, so, yeah. I used to work in employer benefits and we had a patient advocacy service where we tried to fix billing issues for patients. Mostly arguing about billing errors. I had to fight with about 6 people, over countless phone calls, that the care our dude was getting was really an emergency because he was literally dying at the time. I saved him something like $2,000, and the rest of the issues he had with the claims on that particular ER visit/hospital stay got cleared up at the end of that last argument. When he started crying on the phone as I explained, I broke down like a baby. He'd barely survived, and the stress of the bills was eating at his family. "You saved us" still haunts me. Under no circumstances in a civil society should my job have even existed. He never should have had to worry about paying anything after having to fight to live. I grew up with universal health care, now live in the US with insurance. A couple years back I ended up in the ER with a head injury, needing stitches and blacking out repeatedly. The doctor informed me that my insurance wouldn't cover a CT scan, and therefore they couldn't tell me I had to get the CT, but that I really had to get the CT. That look in her eyes. Ugh. Life-defining to be on the receiving end of it, but I can only imagine how many times a day she has to give that very look to people in situations like mine. Through the entire ordeal, the accident, the bleeding gash down my chin, the repeated fainting, once while standing at a window as my insurance info was being run, before I could receive any treatment, repeatedly telling the nurse I needed to sit down because I was about to black out again, then did, the stitches, everything. I burst into tears exactly once. And that was when I googled the prices for CT scans after the doctor informed me she couldn't give me a ballpark of the costs. I got it, BCF it, I can fly to my home country and it's universal health care if/when I get cancer, or another long-term disease, but I can't walk out of an ER, let alone fly 6,000 miles with a potentially undiagnosed brain injury that could kill me within the next 24 hours. I was fine, concussed, and suffered ice pick headaches for months afterwards, which I never sought treatment for because F my insurance, but I don't regret agreeing to pay thousands of dollars out of pocket for something as emergent as that. I regret moving to the US and setting up a life here, where even with an expensive self-employed insurance policy, the worst part of getting sick or injured is the fear of getting medical treatment. Had some weird symptoms, nerve pain, laggy leg, other stuff. ER doctor tried to tell me it was sciatica. It was not. I was in my 20s. My primary doctor sent me to a neurologist, who ordered an MRI. Because of the misdiagnosis, the MRI was rejected by Medicaid, no prior authorization. I appealed and won my appeal, but the process took so long the MRI found nothing of note. 7 years and a lot of other weird things and periods spent with no medical care due to no insurance. I was diagnosed with multiple sclerosis. Diagnosing neurologist looking at my brain scans telling me I have a lot of lesions. I have the relapsing remitting type, so it was years of symptoms, nothing, weird things, nothing. I have permanent symptoms now though. Your doctor ordered an MRI and it was rejected? By who? How is that even a thing? I mean, if my doctor, Canada, puts in for an MRI for me, I'll be getting an MRI, either in a couple days, or maybe a month or two, depending on the priority level set for the scan. Sauce, have had literally dozens of MRIs and ongoing, get a couple regularly scheduled every year now. Has never cost a dime. In before someone else says you do pay. In taxes. I've done the math elsewhere, but in short, family of 4, $80K a year income when I worked it out. Taking my total tax burden, income tax plus sales tax on my remaining net income, and the percentage of tax dollars that go to healthcare, I pay $2,400/year in total for end-to-end healthcare for all 4 of us, with not even a concept of billing, let alone deductibles, co-pays, and other such shit. So sure, I do pay, but show me a US-based insurance plan that would cover a family of 4 to that extent with no deductibles or networks or such shit. And employer-paid insurance is still out of your pocket. They have a budget for staff, and the cost of the insurance provided comes from that budget every bit as much as wages do. It's to reduce waste and fraud, implying that it is the providers who are overbilling or billing incorrectly to make money. The reality is we're ordering stuff because we're not sure and don't want to be sued later. Yes, the patient really does need that surgery. And yes, the patient really does need that medication and the approved medications aren't appropriate. Not to say there isn't fraud and abuse. But I doubt enough to saddle every provider and their staff with extra work and then create worse outcomes. At least for my part of the healthcare sector, I can be audited by the insurance company. And they will take money from me if they find something wrong. Hospital bills are huge in the US, partly to make up for the fact there are so many who walk into the ER without insurance and then can't pay the bill. So they charge as much as they can to make up for it. Americans who shriek about not wanting to pay for someone's poor choices don't realize they are already doing it in the least efficient and most expensive way possible. There are also plenty of countries with mixed systems. I'm currently in Australia, which is a mix of universal healthcare and mandatory heavily incentivized private insurance, for above a certain income level. Our system is stretched, but my wife needed an MRI on private insurance last year, and from memory it cost less than $100 out of pocket, was done the next day, and it certainly will not have increased our premiums this year. A couple of months back I ended up being an inpatient for 4 days for 4 antibiotics and a minor but urgent procedure. I could have chosen to use my private insurance, which I've already paid for, or go public. I went public, as I'd have had to pay several hundred in out-of-pocket expenses in private. My total cost for 4 nights as an inpatient was $0, but I had to pay $15 for oral antibiotics on leaving. All the private insurance is good for is speeding up elective surgery, and covering ambulances. I'd much rather get rid of it and increase funding to the public option. Also, it really depends on how urgent your problem is. I'm Canadian, Quebec and now Ontario, and we have serious problems with wait times for elective procedures. But if you have an actual emergency, you will be seen right away. If you have a serious chronic condition like diabetes or depression or whatever, you will get to see your specialist regularly. Our triage system is robust, strictly enforced and generally pretty well understood, I think. It also doesn't depend on your ability to pay. People know that if they go to the ER and they're not actively dying, they should bring a book and a phone charger. In fact, I've sometimes been relieved to have a long wait. It means there's not much wrong with me. Take for example my mother. She had a sudden attack of intense pain all over her chest and abdomen. My dad took her to the ER. They rushed her back to rule out a heart attack. It wasn't a heart attack, so they sent her back to the waiting room. A few minutes later, they called her back in and checked her lungs. Her lungs were fine, and so they sent her back to the waiting room with some painkillers and the knowledge that she wasn't dying. She then got called back in for a variety of tests over the next 6 to 8 hours until they figured out it was gallstones. Her pain was controlled and my dad went home to get stuff to keep her occupied. The gallstones weren't an immediate threat and the pain had passed, so they sent her home and sent her file to her GP. Some people might see that and say she came in with chest pains and waited 8 hours in the waiting room. But it's more complex than that. She saw her GP the next day. They decided to manage the stones with diet and see what happened. A few years later, the pain was starting to come back. She spoke to her GP, and he scheduled her for an ultrasound. At that point she needed surgery. It was elective but still needed done soonish. She didn't want it done at the main local hospital because they're not friendly, so she had to wait a couple months for the small local hospital. It was kind of assembly line. All the outpatient procedures were lined up on gurneys in the hallway being supervised by one nurse while the surgeon and team saw each of them in order. So no private room or anything fancy. But she got her gallbladder out with no complications. If a car accident had come in and needed the OR, she would have been rescheduled as well as everyone else. It would have sucked, but everyone would have understood. The whole thing probably cost my parents under $50. Parking is pricey and we don't have universal pharmacare. but definitely not a big deal. In fact, I think having universal healthcare makes people more understanding of wait times. There's no expectation of preferential treatment. Most people understand that healthcare is a shared finite resource. People go in when they need to and don't when they don't. The government has a strong incentive to cut down on unnecessary doctor visits. So in Quebec, there are posters everywhere with flowcharts of cold vs flu and when to see a doctor or similar stuff for other diseases. There's a helpline you can call and talk to a nurse. My mother used it all the time when we were babies. Insurance in the US is usually tied to a job. If it's offered, it's usually too expensive to just pay for insurance yourself. So you get whatever insurance the job offers. Problem: every insurance company has a million plans and there's countless insurance companies too. Each plan supports different doctors. They specifically have a system where a doctor may or may not be approved for certain plans. Sometimes Doc John is approved, sometimes he's not. Sometimes Doc Steve is approved, sometimes not. Sometimes both. Sometimes neither. This is all highly variable. If you go to a doctor who is not covered, you either get vastly reduced coverage or no coverage at all, and have to pay largely or completely out of pocket. Most people don't have the money to deal with the lack of coverage. So if you're at Job A with Insurance A Plan A, you go to Doc A because that's the one who is available to you. Switch to Job B because of a better offer or because you lost the old job or whatever, now you're on Insurance B Plan B and Doc B, because you can't afford to go to Doc A anymore because he's not covered. Switch to Job C, Insurance C, Plan C, maybe you get lucky and one of the previous doctors is available. Probably not though. Death or debt ultimatums are very real here. I've personally been involved in a few for myself or others. In the US it's not uncommon for PPL to suffer potentially life-threatening injuries, like my mom got drunk and full-blown tripped face first into a stone hearth and had massive bruising on her face, and decide they don't want to risk the bill. They'd rather risk death than have suffer even the possibility that the trip wasn't worth it. My disease causes some pretty extreme heart and motor problems. I have severe dysautonomia and my vitals can get extremely unstable. Also have something called paroxysmal non-kinesiogenic dyskinesia. That's basically a descriptive diagnosis for episodes of uncontrollable violent flailing that can last hours. I have my own ECG machine. Not even joking. That's so that if I have an episode I can take my own ECG and decide whether to go to the ER. Bought a freaking textbook so I could interpret the damn thing. Had an episode where my heart rate was up to 170 beats a minute. I had severe ST depressions, chest pain, dizziness, and my oxygen was tanking and I waited a couple hours to see if it would go away. Thankfully it did. The nearest hospital was over an hour away. PPL should feel comfortable seeking healthcare when symptoms are that bad. The one time I did call an ambulance I had been flailing on the bathroom floor for 5 solid hours after a heart and digestive episode triggered a motor episode. I had ripped off all my clothes cause I can't control my temperature when that happens, so I cycle between really hot and really cold. I lost control of my bowels and defecated on myself and had already collected 60 or so bruises from slamming against the walls and toilet. They got me out somehow. I blew out of both ends in the ambulance. Nearly throttled the EMT because the only thing I can control is my hands, so I grip stuff. They needed me to loosen my grip on the rail to get in for, and my hands snapped right into their scrubs and I locked up again. Exploded the 4 in my arm. Requested restraints for myself, then broke them all. They wheeled me into the ER naked and covered in puke and crap, and it took them another 5 hours of giving me 4 Ativan, anti-nausea, and pain meds to get it to stop enough to get a CT to make sure I hadn't ruptured my bowels. That's how bad it had to be to make me choose the ambulance. My story isn't even that unique. The ambulance ride alone was $15K. I didn't even bother opening the hospital bill. I can't pay that off. Even a healthy person capable of working couldn't. It's gonna sit there in collections forever.